Monkeypox is on the rise worldwide. The concern that a lot of experts have is that we're seeing the same problems with monkeypox that we saw in the early days of COVID-19. Testing was a challenge at first and is still difficult. So a lot of cases have been missed. We really don't know the scale of the outbreak. We do have a federal stash of smallpox and monkeypox vaccines in case of an accidental or intentional release of smallpox, but those vaccines were not easily accessible and there weren't enough of them. So the U.S. has ramped up the supply, but it's still not enough at this point to meet demand. Treatment has also been a challenge. Doctor told me it was taking 3 hours of paperwork to get treatment for one patient. The experts I talked with were kind of shocked and horrified that we're in the same situation again. The explanations they gave ranged from a lot of systematic problems. So in the United States, we don't have a centralized system of public health. Every state has its own health department. The CDC has limited powers. So that's one of the issues, is getting sort of a consistent message and system out there. Funding has been really bad for public health for a long time. We're still in the COVID pandemic, and public health officials are just totally exhausted and strapped from 2.5 years of dealing with that while having too little funding to deal with that. So the federal government is stepping up its efforts to address this problem. They have made more vaccine available. They have made testing much more accessible. You can now go to a testing lab in your community. So they are addressing many of these issues, but the experts I talked to said it's taken a little bit too long to get to this point. As somebody said, they're finally starting to fight the fire, but the fire's been raging for 2.5 months. So monkeypox will never be as widespread as COVID. It's much harder to transmit. You're not going to get it from casual contact. And the comparison that was made to me several times was with HIV. So HIV is unfortunately here to stay in the US. It's not going anywhere. I'm not vulnerable every day of my life to HIV the way I am to COVID, but clearly some behaviors or exposures are possible on an ongoing basis. So that's really the concern.
Hey, thanks for watching. If you like this video, check out these other videos from USA Today to stay up to date with all the latest news.